about us. Think about.
Hello. What's going on? Let's see. I think I'm good with the overlay. Okay, I'm just going to do this right now. Let's see. Where are we live on Instagram? No, we're not. We're getting there. Okay. How's everybody doing? I see Roel's in here. D. Lynn. What's up? My brother Steve. What's going on? It's been weird weather in East Tennessee. Tom, what's up, my brother? Frida, hello. Great to see all of you. Foxy Moxie, what's up? Grandma Mary, happy Tuesday to you. I love you. Let me know you're here. If you're new, let me know. Stan, what's up? So good to see everybody. Thank you guys. Carter, happy Tuesday to you. Carter, you sent me a text yesterday saying happy Tuesday on Monday, and I thought that was the best thing ever. And it threw me off for about 30 seconds. And I was like, oh, it's Monday. Tom, yes, that is wild. That is wild. Super, super interesting. The AI in healthcare is going to be it's going to be an interesting conversation probably in the next couple of years. TC, welcome in. We answer health and wellness questions here. TC, I hope we could bring some value to you tonight. Well, Carter, happy Tuesday to you for the second day in a row. Jerry, what's up? Welcome in, TC. Thank you, Foxy Moxie, for welcoming our friend in here. We do this every single week, 7 to 8, answering health and wellness questions. I see Montana's in the building. Montana, I miss you and I love you. Great to see you. Let's see here. Angie, happy April 1st to you as well. I've it's funny. Maybe Carter, maybe that was an April Fool's joke on March 31st. I've been a little skeptical of all my everything I've been reading online and everything because of April Fool's Day. Happy April Fool's Day, everybody. If you guys got questions for Doc, go ahead and put them in the comments. We did not get any questions that came in throughout the week. If you sent in one and I'm missing it, if you don't mind, send it to me. Send it to me now. I have my eye on my email in the corner of my eye. And I'll make sure that's anonymous if you would like it to be. But let's go ahead and we'll start gathering questions, and Doc will be in the building very shortly. Real quick, I want to give a shout out to Ben Blessing from Kingsway Pharmaceuticals. I want to thank him for hopping on the Common Sense MD this week, talking about topical medications. Super, super cool. They're doing amazing things at Kingsway over there in Bristol, Tennessee. Shout out Bristol. We actually have a beautiful office there in Bristol over there on State Street. I love this episode right here. A lot of you guys have talked about or asked questions about GLP-1s, the Ozempics, semaglutides, tirzepatides, Mounjaros. Our nutrition coach, Lucas Schmidt, based out of the Johnson City location, talks about, kind of the must-haves. Like, this is an important podcast episode around, okay, I see you, Carter. I see you. Around what to eat, what to do while on Ozempic, semaglutide, tirzepatide. One thing Lucas did say is he thinks that like there should be a warning on these GLP-1 class of medications that if you get on one, you need to be doing some sort of resistance training. One of the things you'll see is you'll see muscle loss. So you need to be doing some resistance training, making sure you're getting your protein in. He talks about all of that in this episode. So if you're on a GLP-1 or want to be, look at that to get the most out of these amazing weight loss medications. Happy Tuesday to you, Montana. Patrice, let's see. Patrice, did you send that to my email? Oh, maybe that was what I'm missing. Okay. Okay. Sweet. Thank you, Carter. And Patrice, if you can you email me real quick, or you can put it in there, whatever you'd like to do. Edna, what's up? Thank you, TC, for that. Great questions. Look at that. You know what? I love this, Carter. This is so cool. Brookhaven Farm, shout out. We're going, low carb Tuesdays, carnivore Tuesdays. I love it. Thank you, TC. I got you. Thank you. Patrice, do you want to just know the difference between NAC versus inositol versus inositylcholine? Is that what you're asking? I just want to make sure I'm reading that right. Cool. We're getting some great questions here, guys. Thank y'all. And I'm going to get this from, let's see, I'm going to put this in. Sorry, I'm reading this question. See if I can put it in here. Okay. That's a okay telemedicine question. I'm with you. Okay. I'll look, Patrice, and I'll get it in here. Sweet. Thank you guys so much. Hold on one second. Let me get my phone real quick. All right. One thing I want to put this up too. Thank you, Roel. I see you. I want to put this up. We put this in our weekly email. Performance Weekly goes out Tuesdays at 3 p.m. Went out today. We put this up from Robin Riddle. She didn't explain this episode on low dose naltrexone. Ton of you guys are asking us questions online around LDN. And we're telling people to watch this video. Robin goes over everything, how we're using it in integrative medicine. So super informative episode. I'd be shocked if LDN doesn't come up tonight in a question. So just know that that's a great resource for you. Okay, I see you, Patrice. Thank you for putting that up there. That's perfect. All right, let's see if Doc is ready to roll. Okay. Let's see here. I see you, Carter. Okay. We are gathering questions here. Thank you, guys, for being with us this evening. Edna, I see your question. Thank you so much. Love the PSA questions. Patrice, is it cool if I put that on screen when we bring it up to Doc? All right, is Doc ready to roll? Okay. Got it. Okay, cool. All right, let's rock and roll. What's up?
Hey Ben, how are you?
I am wonderful. Hold on 1 second. Okay, there we go. How was your day?
Had a great day. Very busy day.
How is the weather? I feel like we've been through 3 seasons in one day today. It's been raining.
Great. It's beautiful all day.
It was cold here at one point. Maybe early, maybe first thing in the morning. It was a tad bit chilly. Robin, what's going on? Robin and I are getting ready to film another series of Explain This episodes. I'm super pumped about it. If you, by the way, while we have everybody here, if you guys have, topics you want us to dive a bit deeper on, whether, through an Explain This episode, a dive into diet, a Common Sense MD. Okay. Thank you, Patrice. Put it in the comments. We'd love to make sure we're putting out stuff that you guys want to learn more about. Ivy, what's going on? Ivy and JC with Ivy. Pop, you ready to roll?
Ready. Yeah.
All right, let's start. I want to start with Patrice's question because she was kind enough to send that in through Facebook, and she's being patient with me tonight. So thank you, Patrice. I'm just going to put this up, and then we'll start with this, and then we'll get to the rest of the live questions. So if you have a question for Doc, go ahead and put it in the comments. And do you want to touch on a topic that we missed last week, or do we need to do more research?
No, you're talking about that Icarius?
Yeah,
Yeah,
yeah.
yeah, that's just horny goat weed. It's just the plant name for horny goat weed, which is a Chinese herb that they use in Chinese medicine for centuries for libido, erectile dysfunction, that type of thing. So, I've had patients that take it, and it's supposed to increase your testosterone, kind of like tribulus or maca. There's a lot of these herbs that they use for sexual dysfunction in Chinese medicine, and that's just horny goat weed. It's just another name for it. Um, I've had patients that really like it. Again, the quality control is going to be tough. You don't know exactly, in some cases, how much is really in it and that type of thing because it's non-regulated. Not that that's a bad thing because no vitamins are really heavily regulated by the FDA. But so you have to kind of know the source and all. And there are some trusted names in that. But what it is horny goat weed, and it's usually used in combination with other things like tribulus, maca, long jack, some of those things. But in some cases, they're pretty effective. I have had one patient that comes to mind that really had a problem with taking the combination. It had a lot of side effects. So if you do it, be careful with it. There's no real long-term studies with it. So you could take it intermittently. I don't recommend you take it months and months on end every day, but that's what it is, if you've ever heard of that.
So would you say that this is just a more natural way to increase your testosterone level? Just like if you don't want to get
Yeah,
on testosterone?
yeah, yeah.
Okay.
The people I
Um,
have that take it, usually, they want everything all natural, herbal, and that type of thing. So some of them like it. Um,
Out of curiosity, just to, for the people in here who don't know, what do you normally recommend if somebody wants to go the natural route? Say they're a little younger, but they're wanting to increase their testosterone. How are you looking at that? Because I haven't heard you say this one in particular.
Well, yeah, if you're young and have low T, we need to find out the cause of it, whether it's primary or secondary hypogonadism. So I check different hormonal levels, including luteinizing hormone, follicle stimulating hormone, prolactin. A lot of times, if they have obesity or they have diabetes or they have other confounding problems, you solve the problem, especially with diet, nutrition, exercise, stress management, sleep can be a real factor. Because when you start a young person just on testosterone, then it can kind of lower their fertility rates for sure, but it also can, um, kind of subject their own pituitary gonadal axis to deprivation, and so they don't make it on their own if they're receiving it exogenously from another source. So you have to know what you're doing with these hormones, especially in a younger person. So if somebody asks me an herb to take, I would probably maca is probably my favorite one. But I mean, usually there's a combination of all these. Maca, tribulus, and then horny goat weed's another one. Horny goat weed seems to be a little more potent. Some of the others, but it's probably better for ED than it is for libido. But usually they use a combination. So, and I'm not sure some of these supplements don't have a little real testosterone in them either. I'm convinced that they may have some of that in there, but because I've seen testosterone go up pretty high with just that, but it was kind of hard to believe there wasn't some extra real stuff in there. So you just have to know what you're doing with younger folks with low T. Sometimes I'll use Clomid to try to stimulate their own luteinizing hormone to turn on their testicular production of testosterone. So, but certainly for mild cases in young people, just go slow. If you do try this, just be cautious with it and try a reputable source for sure.
I'm going to put this up from Evangeline. Evangeline, so good to see you, man. Thank you for being here. Wouldn't a half dozen eggs a day increase testosterone due to an increase in healthy cholesterol levels? That's interesting. I've never thought of it that way. What's your
Yeah,
thoughts on
I
this?
mean, like I was telling a patient today that um, testosterone comes directly from cholesterol. So the problem is eating eggs doesn't really increase your cholesterol by much, to be honest with you. It's more your liver cranking it out. But I think eating a half dozen eggs a day and lifting weights is a good way to pop your T up and build muscle for sure.
Mm.
It's a great strategy.
Evangeline, thank you, brother. Zach, I see you, my man. Go Vols. It's so good to see you, brother. Let's put Bo up here. Bo, man, I love you, man. So good to be with you here in the
Hey, Buck,
Knoxville office. Love our
a
our
walk in
walk
the
and
park.
talks.
A
Yes,
walk in the park with Bo.
walk
That'd
in
be a
the
good.
park with Bo.
That'd be a good little tile for Bo's new Instagram.
I
A
love it.
walk in the park with Bo.
I'm overlooking that park right now, and that's where Bo does his walk and talks. I love
Yeah,
it, man. Bo,
he
thank you for
talks
being here
mostly to
today.
homeless people over there, doesn't he? Or drug addicts and homeless people.
Oh, no. We're clearing that up
I
a
mean,
little
he's
bit.
helping them out though. He's helping them out. They all have low T.
All right, guys, we're gonna get to some questions here. I'm gonna get to Patrice first, and then we'll get to the other live ones. Appreciate you guys being with us tonight. If you have a question for Doc, put in the comments. Patrice, thank you for being question with me. Sorry for being patient with me. Let's see. I've heard of NAC. I remember Robin talking about it as N-acetylcysteine being good for the brain, and I think I remember Dr. Rogers talking about it as N-acetylcholine being good for the brain. Anyway, what are the two different NACs? What are the two different NACs good for? N-acetylcysteine and N-acetylcholine. I'm confused between the two. Patrice, this is such a great question. What's your thoughts on this, Doc?
Well, when most people say NAC, it's N-acetylcysteine.
Okay.
And usually when we say acetylcholine, we mean acetylcholine, just those two words. But and N is just an isomer. But we usually use N-acetylcysteine for it's actually a medicine, a drug that we use for. It's called Mucomyst. We use it for Tylenol overdoses. It saves lives. That's why the FDA doesn't like people using it for supplements, because it's actually a prescription medicine in cases, but it's so widespread that we use it. It's a really good precursor, really, to a glutathione, which is kind of the ultimate antioxidant supplement that we use. But NAC's just a great. It helps breathing. It helps your brain function as well. But the acetylcholine is more as functions as more of a neurotransmitter for the brain. So we use it. We use it more for that, for people that want to preserve, not get dementia and that type thing. So that's kind of the difference in those two. One increases the glutamine levels in your bloodstream, and the other one helps all your neurotransmitters kind of function better. And it usually, when I use it for brain, I usually use a different form called phosphatidylcholine, phosphatidylserine. So, and choline is just plain choline is a little bit different. So there's a lot of little nuances between these things that sound a lot alike. So that's kind of the way to think about it. NAC, increase glutathione, help your immune system. The acetylcholine and phosphatidylcholine work more for neurotransmitter propagation and brain function.
All right, thank you for that, Doc. Patrice, does that help a little bit? One, I mean, I would ask the same thing. That's super. I even pronounced them the same way.
That may not even help, but there is some subtle differences in some of those sound kind of similar, but they have different functions.
Thank you, Patrice, for that. I see you, Roel. NAC really help with nasal breathing. That's awesome. Yeah.
Yeah, yeah. NAC. We used a lot of NAC during COVID.
All right, we're going to get to the questions here. Thank you guys for being with us this evening. If you have a question for Doc, go ahead and put them in the comments. Let's see if I can decipher this from TC. TC is new here tonight. Thank you, TC, for being with us. I have large bumps on the top of my feet, wondering if from sandals or something else. I hope to get rid of them, stop wearing those sandals on each foot. Let's see if I can, am I missing something, TC? Any thoughts on this as far as like,
you could be rubbing your, the tendons and connective tissue in your feet so that you can form kind of like an osteophyte. And I hope that's what it is. It's usually not anything bad, but certainly I see it a lot. You can get you can also get cystic structures on your feet, just like you can in your wrist. So like a ganglion cyst, you can actually get them in your feet too, which is really a damaged little tendon sheath that the synovial fluid works its way up towards the top and forms a bump. And they're sometimes painful, sometimes have to be surgically removed. One large bump on each foot, on the top of the foot. I mean, it's something, maybe you're rubbing that on there, but if it feels really hard and like a rock, it's probably an osteophyte made of calcium. If it's real soft, spongy, it may be more of like a cystic structure, maybe a mucinous cyst, that type of thing. But so I hope, when you quit wearing those sandals, and if it's in a place where your sandals rubbing it, see if it'll go away. If not, you're probably going to need to see a podiatrist or see Brittany Miller, our PA that worked podiatry for 8 years. She could definitely tell you what it is. So if you're in this area, come by and see Brittany, and let's see what it is. So the fact that it's on both feet is actually a good sign. So try that and see what happens.
TC, thank you so much for that question. I hope that helps a little bit. Stephen, I see you. Thank you for that question. All right, we're going to keep moving here. I think I was, if I could find where I was, let's get to Frida. What causes your heart rate to be low, staying in the mid 50 range? My hubby, his blood work all came back good and EKG was good. When it happens, he is real tired and sleepy, goes to cardiologist on the 10th. So it seems heart rate's low. I guess maybe at night. What's your thoughts on this? Yeah, that's interesting.
Yeah, my heart rate stays in the mid 50 range. Some people's are just normal. At night, mine drops down in the 40s. I monitor it every night through my sleep 8 bed and my Oura ring, so I know exactly what my heart rate's doing all times. But you can have a normal EKG, and it may not be catching it. Remember, an EKG is just a snap time shot of something. So the fact you have a normal EKG doesn't mean a lot, other than if they're looking really into it, whether your PR interval is prolonged. You could have a first degree block. So really, you need a Holter monitor, and that you wear for a couple of days and measure every heartbeat you take for 2 days. If he's symptomatic, you push a button and make a note, and then they run it through a computer and it kind of analyzes it. I don't know if he's on a medication that could be causing that. There's certain medications that can cause a low heart rate. There's other conditions that can cause it as well, metabolic conditions, hypothyroidism, adrenal dysfunction are two that come to mind. So hopefully, if you're gonna see a cardiologist, that's the place to go to get a good workup and see. But first degree heart block's not that uncommon. You get second degree, and then the third. That's something that sometimes they have to use a pacemaker on. But hopefully, his is not that degree. But certainly get some really advanced blood work and see what happens, and see if you can tie it to anything that's, if he's under a lot of stress. Is he sleeping well? Does he have sleep apnea? Look at all those things. Let us know what happens with that. It's interesting. So it'd be nice to know what his normal heart rate is. Some people's heart rate's normally mid 70s, other people's 50. So
Well, yeah, let me ask you, because, immediately I've always thought that a low heart rate means you're like in really good shape, and like, because
usually that's what it means. Yeah, usually what it means, but it also can mean you have a little minor heart block, which is it's a little quirk in your electrical system. Your heart fires off by electricity, and sometimes those circuits get a little off, or you maybe have been born with, kind of an abnormal circuit that leads to a low heart rate, skip beats, that type of thing.
That's super interesting. Frida, thank you so much for that question. I hope that helps a little bit. Okay, and keep us posted. He's going in on the 10th. So keep us posted with how that goes, Frida, with the cardiologist. Real quick, I'm going to move over here to Instagram. Love you guys over here. I see Jackie's in here. Jackie, so good to see you. Jackie is asking, I can't put it on the screen because I haven't figured out how to do it. So I'm just going to read it off for you, Pop. From Jackie here, what are the optimal levels for Hashimoto's? It's so hard dealing with a FMD that gives such a huge range. Forgive me, what does FMD mean? I'm sure that's some sort of
functional medical doctor.
Oh yeah, maybe that's what it means.
I don't know what it means.
Yeah. Well, what's your?
Maybe it means a fake MD. Maybe it means a fake MD. I don't know what they're doing. There's a big range in the TSH for, again, Hashimoto's is the most common cause of hypothyroidism. And if you're talking about the TSH range, they're very wide. They're from like
family medical doctor is what it means. I love that.
Family medical doctor. Okay.
I love that. I should have known.
Nobody ever called me that. FMD.
Okay, so optimal levels for Hashimoto's, and it's hard to deal with such a large
with the TSH range. Is that what you're asking? TSH levels, or
is it TSH, Jackie? Which particular thyroid levels are you looking for?
You may be talking about antibodies. You may be talking about T3, T4, TSH, reverse T3. You're probably talking about TSH, I would guess. Is that what they're talking about?
Let's see here. Jackie, let me know. TSH, T3, and T4.
Yeah. Well, TSH there's a wide variety. It goes from, in most labs, from like 0.3 to 4. In my opinion, you need to subjugate your TSH to around 1, if possible. I like that. But the money's in the free T3. Remember, T3 and T4 don't mean much. It's the free T3 that is where the gold is, because that's the active form of thyroid. It's a free T3. And generally, the ranges on most labs, I think, are like 2.2 to 4, somewhere in that range. I really like to hit it about 3.5. And really, I don't go just by labs. I go by symptoms. Sometimes I'll go by body temperature. That helps out a lot too. If Hashimoto's, I also like to follow TPO antibody levels to see, what they're doing, because those antibody levels can show you if they're coming down, it's good. If they're going real high, it means you still got that autoimmune inflammatory response going on. So I'll follow those as well. You get pretty technical about it, but a lot of docs just go by, most traditional doctors just go by the TSH and a T4, which is really not giving you what you need. But if you're looking at purely a TSH, which isn't the best measure, I want it to be 1 or maybe even a little bit below 1. Body temperature sometimes is as accurate as a blood test, maybe more accurate. So you always listen to all the symptoms, and some people need a little more. They need their T3 to be a free T3 to be a little higher, and so you need to see if they're converting their T4 into T3. the active form of thyroid. So a lot of people don't really understand thyroid or listen to the patient. There's a lot of playroom in there for symptom control, really. So I look at that more than anything. But you're probably asking me, what should your TSH be? 1, preferably. When remember, 0.3 to 4 is normal. You can be sitting at a 4 and feel terrible. So you need to pop up your T3. And there's different forms of thyroid medications. I prefer the more natural products like Armour and NP. I rarely use Synthroid or levothyroxine anymore. Sometimes I just use T3 called Cytomel. But my preference is really to use a desiccated pig thyroid like Armour or NP. Because people just seem to feel better on them. I take a tiny dose myself, and I don't even have a low thyroid.
And I want to for Jackie here. I want to put this up from Robin. So Jackie, what you should do is there's 2 Explain This episodes with Robin on Hashimoto's, and then the other one is actually called Optimal Thyroid Balance, and it's super detailed. So if you search for Hashimoto's Robin Riddle or Optimal Thyroid Balance Robin Riddle, probably if you just search for thyroid, then both of these videos will come up. And that's another tip for everybody in here. With a lot of these topics, if you want to dive deeper, if you put in the subject plus Robin Riddle or performance medicine, a video should show up over there on YouTube.
That's a great, very detailed video that Robin's done. She's an expert on Hashimoto's.
So definitely check that out if you haven't already. Thank you, Robin, for putting that in there. Okay, let's keep rolling here. And I got my eye on Instagram too. So if you guys have questions, I see you naturally, Ashley. It's so good to see you. It's so good to see you. Thank you for being here tonight. If anybody on Instagram has questions, I'm looking at Instagram as well. Okay, let's keep moving. Let's see if I can find where I was. Apologize in advance. Let's go to D-Lyn. D-Lyn's with us each week. Thank you so much, D-Lyn. I read where detoxing will stop cure sugar cravings. Is this true? If so, what's the way to detox?
It's very true. The obvious, more natural ways to detox is drink more water, sweat more, do deep breathing exercises, and also think about your gut, how your gut balance is. If your gut's bothering you, then you probably need a gut detox. That one Andy did was that parasite cleanse was really refreshing for him. It really helped little eczema rashes that he had. And of course, being a type 1 diabetic, he's very familiar with sugar cravings. So, I really like berberine for sugar cravings. And remember, once you cut out sugar, you won't crave it. You just have to get over it. It's almost like going through a little withdrawal. I had a patient today who did not understand nutrition because she'd been taught the normal stuff. So when a patient asks me, like she did today, I'm not losing weight. I'm eating a great diet. And I'm just stuck. I can't lose weight. So I always ask them, when you say you're eating a great diet, what did you eat for breakfast this morning? And in this case, it was cereal, cold cereal with milk, a banana, and Greek yogurt. And then when I said, what about lunch? And, drank my, I love iced tea. I go, sweet tea? She goes, no, not sweet tea. I use half and half. You cannot, number one, you can't eat cereal in the morning for breakfast and expect to lose weight. You certainly can't eat Greek yogurt, and you can't eat bananas either. Not that bananas are all that bad, but they're sugar. The other thing, you can't drink half and half sweet tea. I mean, that's like smoking half a cigarette. You can't do it. If you're trying to lose weight, a couple of simple ways to do it are, number one, cut down your carbs. Number two, do intermittent fasting. I love fasting is another way to detox and to reduce sugar cravings, whether it be an intermittent fasting or 2-3-day fast. They're great for you. I try to get all my cancer patients to do some fasting. But yeah, it will. And those are the ways I look at it. Some of the simple stuff like exercising and drinking more water and having normal gut function. That's how you get rid of toxins through your gut, your bowels, and through the air, through your sweat, all those normal things.
And one thing, it's such a great question, Dealan. Thank you for letting us talk about it. I another crazy thing. I kind of want to ask the people here with us live if anyone in here is taking a GLP-1, any of them, have you noticed a decrease in any of your cravings? One of the big things that we're hearing from patients and in all the studies is people are getting off some of addiction to sugar, even alcoholism, which I think is one of the side effects of the Ozempic semaglutides is not having the addictions you might have had. And we're as a society, we're probably addicted to sugar, I would imagine.
Yeah, Bo mentioned to me today about a good video about the GLP-1s that is really good about all the advantages of it. Again, it's in a way it's a natural gut hormone. Your gut produces glucagon-like peptide, and it tells you that you're full. And a lot of people just don't have enough of that hormone, that gut hormone. So in a way, it's almost a natural way, even though it's made in a lab and you're injecting it once a week. But you always have to weigh the risks versus the benefits of anything you do in medicine. And in this case, for most people that I see in America, almost everybody could use a good dose of it or a small dose of it. So very advantageous to think about, especially if you have insulin resistance, metabolic syndrome. I mean, it's been a godsend, to be honest with you.
Real quick, my brother Kyle is in here. I want to give a shout out to the wards, and I hope you're there with Antonio. Say hello to Antonio and Luca for me. I love them.
Hey,
but Kyle mentioned that mental clarity is another benefit of the fasting. Kyle does the 72-hour ones.
Awesome.
And it is.
I've done it. And your brain works better on ketones than it does carbohydrates and sugar. So, yeah, I mean, it's not easy to do. Yeah. But once you get into that zone, you should do it. I don't know how often Kyle does it, monthly maybe, but
yeah, I think he's monthly.
Kyle, you should see him. He's built like a Greek god.
He's a Greek god.
Because he knows how to tie a Windsor knot.
Yes, he does. That is a fact. I'm gonna put this up from Carter because I just love these different little use cases. I can report that even my very low dose GLP-1 for migraines decreases cravings for sugar. I'll be the first to admit I love a little sweet treat. Yeah, that's amazing. That's so cool.
Yeah, very true.
Thank you, Carter, for that. I see Katie's in here. Katie, what's going on? So good to see you. Okay, let's see where we're at. We're going to get to some more questions. We're going to answer everything tonight. If you have a question for Doc, put in the comments and we'll get to, hopefully I'm not missing any. Let's see where I was. See, we got a lot of good success stories too. I want to put in here. So thank you guys for putting those in there. Let's see, Leanne, and then I know I'm missing a few. I'll get to everybody. Hi, what would your typical process be for low free testosterone in a male?
Yeah, of course, we see that every day. And remember, it is the free testosterone that's the most accurate measurement. Now, if somebody has a low total testosterone, you don't even need to check a free. It's going to be low. But if they have a decent total testosterone, they may have a low total or free testosterone, which is where all the money is. So they may have a high sex hormone binding globulin that takes all the stuff that really works. Remember, out of all your testosterone, only about 3% of it actually works. It's called free testosterone. But a lot of this depends on what age the patient's at, what pre-existing conditions they have. So, typically, if it's a young guy, I'm going to find out his lifestyle. I'm going to look at a whole panel of tests, including cortisol, prolactin, luteinizing hormone, follicle stimulating hormone, total free sex hormone binding globulin. And we'll determine whether it's primary hypogonadism, which means testicular failure, or secondary hypogonadism, which means pituitary underactivity or failure. So the way you approach it depends on the age of the patient. Now, say you're a young guy and you have a low luteinizing hormone, not enough of the signal from your brain to your testicles to make testosterone, then I'll use something like HCG or Clomid to try to stimulate that to kind of jumpstart your own production of that. Those are fertility drugs, but we use them in males as well in the right circumstances before we go straight to testosterone. Now, if it's high or the patient's older and is not going to have any more kids, doesn't care about fertility, which is more typical than anything. Although I do see a lot of young guys these days that work shift work, that have all this stuff, they have low T at a young age, 20s. But typically it's somebody getting towards the andropause, it's the male menopause. And I'll also check an estradiol level to see what their estrogen levels are as well. Some guys after 50 come in with higher estrogen levels than their wives. They're aromatizing their testosterone to estradiol, which isn't good for men. So say they do have low T and it's just because of aging and stress, lack of activity. Now, of course, I always encourage, first of all, good diet and exercise. Sometimes just exercise will boost your T up. Zinc's another one that helps with that. And like we talked about before, sometimes they've already tried, some of the herbal remedies that we talked about. But so then if it is low and I determine this patient needs testosterone, then I usually give them a choice. Would you like testosterone creams? Which most of them say no. I don't think it works that good in men, to be honest with you. There's one new oral testosterone pill that I don't use it much. I just don't use it much. It's not supposed to run through your liver or do that, but I usually use T shots, a weekly shot of testosterone. And then in a couple of months, I'll check the levels or certain things you have to watch out for, like bumping up of your red blood cell count, aromatization to estrogen. So we kind of, titrate it into the right dose. And if they don't like giving a shot every week, then sometimes I'll put pellets in them. Did several of those today, where they just slowly release over about 5 to 6 months. We implant those in the hip area around the top of the buttocks. So we do a lot of that. We do a lot more pellets in women. But that's kind of the process. Determine what may be causing it and any way we can stimulate it to bump up on their own. If not, just go to testosterone. And typically depends on the age, but a lot of times if you're in that 50th age, I give you a little break from testosterone every once in a while. Sometimes I use Clomid or HCG in between the break, sometimes with it if they want to remain fertile, that type of thing.
Yeah.
So yeah, it's a pretty, gosh, we do thousands of men with low T. And we have a really good protocol. We do it right. We don't just say, yeah, here's your testosterone. We do it right.
Leanne, I hope that helps. Doc, thank you for that answer. I want to keep going here. I want to get to Roel because I missed you. I'm sorry, Roel. Roel is asking, my brother recently had blood work and found out his triglycerides were very high 600s. He's been prescribed some medications. What are your thoughts?
Yeah, he was probably prescribed Gemfibrozil, Lopid. That's a little high. I mean, it's not out the roof high. Sometimes I see them over 3,000. First thing I would say is, what are you eating? And balance the diet out a little bit better. Then I always check fatty acid analysis, and a lot of times omega-3s, fish oil, good quality fish oil will bring that right down. Sometimes as good as the Gemfibrozil will, which is almost like it absorbs triglycerides through your gut. So sometimes I'll use that, but it does need to come down some. I think triglycerides are important that you get them down, even more so than cholesterol. So I hope that helps. But make sure he's taking some good quality fish oil. Most people can tolerate the Gemfibrozil pretty well. It's not like taking a statin for cholesterol. So.
Roel, thank you for that, brother. I hope that helps a little bit. I see Edna's question here. Thank you, Edna. Have male family member 70 years old. His blood work came back with a PSA at 13.2 and a GFR at 27. Should he be concerned?
Yeah, he should be concerned. Being myself a 7-year-old male, PSA of 13 is pretty high. He needs an exam of his prostate and finding out what kind of symptoms he has. A lot of times I'll find that it's just benign prostatic hypertrophy. And it's really important. It's not the absolute PSA number that we're concerned about. It's the velocity of the PSA. Like if last year, and you certainly should do them yearly, if it was 5 and now it's 13, that's something to really look. Yeah, you got to be concerned. So an examination, see what we feel in the prostate, and then probably I would get an MRI of his prostate rather than go straight to biopsy. And also his GFR is low. He's got kidney problems. So, yeah, that's more immediately concerning than the PSA is. That's a low glomerular filtration rate. That's renal failure. I don't know if he's a diabetic, if he's had hypertension through the years, if he has some weird proteinuria problem or glomerulonephritis. He's got to see a nephrologist if that's a true number, because that is low. That's the most immediately concerning thing that he needs to be told. He may have just such a huge prostate that's affecting his kidneys as well. It'd be interesting to see how he's urinating, but yeah, he needs to get to a good doctor.
And I know that probably wasn't the answer that you were wanting. I hope that helps a little bit, and we'll be thinking about your family member with that. So keep us posted. Okay, let's go to let's see where I'm at. These questions are so great. Thank you guys for putting these in. These are helping so many people. Linda's asking, does the amount of protein you eat while taking Ozempic make a difference in weight loss? Great question.
Great question, especially Linda Carter, Wonder Woman.
Linda Wonder Woman.
Yeah, Wonder Woman was Linda Carter. If you're as old as I am, you used to watch Wonder Woman because of that outfit she wore, Star Spangled Banner outfit. And her name was Linda Carter, I think. Correct me. If there are any old people like me out there, tell me if I'm right.
Are we? I have no idea. I have no idea.
You're too young to know that. But anyway, yeah, it certainly does. As you know, when you take a medicine like Ozempic, you can lose muscle with it. You can lose 30% muscle. But if you're working out and eating enough protein, which most adults don't do, then yeah, you can overcome that. That's why one reason I like to do an InBody test ideally before you get on a GLP-1, to kind of follow that, because I don't want you losing muscle. And that's another reason we use testosterone, because it helps muscle. And I recommend that almost all my adult patients take creatine with HMB in it, which is just almost a mandatory thing, I think, for any adult. So yeah, you need to eat more protein.
And I'm going to put this up for you, Linda. As soon as we're done here with this show tonight, watch this with Lucas. He goes over exactly what to do. His first thing was like, I loved what he said, because with the GLP-1s, you're obviously not going to be that hungry. So you have to be very efficient with what you consume. And basically what he talks about is you got to make sure you get your protein in, because you're not gonna want it in a lot of cases, certainly not with every case. So thank you for that question, Linda. Let's get to Angela here. Angela, thank you for being here. Seeing a lot about using low doses of nicotine patches or gum for autoimmune cognitive issues and clearing out spike proteins. Any thoughts? I'm interested in your thoughts. What's your thoughts on this?
Nicotine patches or gum, not in cigarettes, is actually good for a lot of people. We started using it during COVID, and it worked fantastic. There's a lot of evidence to it. It helps ward off dementia, so it's definitely great for your brain. And I've done a podcast on nicotine in the past, and I think it is good for autoimmune issues as well. It's not really part of McCullough's protocol for the clearing out of spike proteins from the vaccine, but it's certainly one that you can consider. It's very underutilized. I use it a lot for people that during COVID that couldn't taste or smell for prolonged periods of times. And a lot of times it worked. But nicotine is habit forming for sure. But so you always have to weigh the risk versus the benefits, but it's underutilized, especially for brain function. Of course we use it to try to get people off of cigarettes and chewing tobacco and snuff and all that. But yeah, I've recommended it a lot to people, and really it works pretty well. I like the patches better than the gum.
Yeah.
But yeah, great question.
Thank you for that, Angela. Great question there. Let's get to Ramona. Hi, Dr. Rogers. I have 7 immune-mediated conditions, one of which is diabetes, and I am on the verge of having to switch from pills to insulin. Is there anything that can be done to calm my immune system down and help my diabetes?
Yes. It's called low-dose naltrexone. You're one person that needs it desperately. Go to our podcast on LDN. And
there's one I'll put up here. One with Robin here, and then we've got this one with you. Lots of videos on LDN, Ramona. So definitely check that out. Keep going, Doc. I'm sorry to interrupt you.
No, that's a good point. Yeah, we've done several good videos on that. And the way it works is kind of unusual, but it kind of tricks your brain into releasing its own endorphins, but it really tampons down that immune response. So, and it is a prescription medication. You need to go to a doctor, like an integrated medical doctor like we are, that knows about it and how to use it. But yeah, I saw a patient today that just had Sjogren's, had rheumatoid arthritis and lupus, and got off the methotrexate and prednisone just with LDN. Felt way better. So yeah, and I hope you don't have to go on insulin. I don't like putting a type 2 on insulin. I don't know if you've tried the Ozempic, Mounjaro type shots, or once a week shots, but there's a lot of advantages to those, and they in turn may help calm down your immune system as well. There's other, we have an immune formula that has several things in it, including NAC and quercetin that I like. But think about, do your research on LDN. And, of course, I have 2 type 1 diabetic kids, and they both take LDN. They're type 1, so they have to take insulin. Type 2 should never, hardly ever have to take insulin, in my opinion. Rarely.
Ramona, I hope that helps a little bit. I see there's a lot of Linda Carter fans in here, Pop.
So was I right? Yeah, Linda Carter, Wonder Woman.
You're right. I love it. A lot of Linda Carter fans. I love it. Okay, I know I'm trying to find my place here, guys. I apologize if I'm missing anybody. Let's see here. Where am I? Let's get to, I see Wayne, and then, okay. Let's get to Wayne here. Wayne, thank you for being here. If one was obese and started on tirzepatide a couple months ago, could you add tesamorelin or CJC 1295 with ipamorelin, or wait until you've lost most of the weight before beginning such a regimen? That's a great question.
Yeah, and you can go ahead and start it.
Yeah.
Never start 2 medicines at the same time. Because if you felt bad or good, you wouldn't know which one did it. So yeah, I love CJC 1295 with ipamorelin. I'll take that one. But yeah, good. Tirzepatide, I love it. I love it. I love both those. They're all peptides. Insulin's a peptide as well. I don't want you to have to take insulin.
Thank you for that, Wayne. Let's get to Jerry here. I managed to get serapeptase and using red light therapy that you suggested for my keloid on my mastectomy scar. I've noticed
Yeah,
it has
awesome.
started leaking down. Is that it breaking down? I've noticed start leaking light brown fluid. So I'm assuming, is that am I reading that right, Pop? I've noticed it has
Yeah,
started leaking
yeah. So
light
your
brown.
mastectomy scar
Okay.
is leaking a little bit. I don't know how far out from your mastectomy you are. But usually when I see something like that, it looks like it may be, blood possibly.
Mm.
So you need to get that checked out for sure and make sure it's not getting infected, or it's not healing for some reason. I do love the red light. The keloids sometimes bleed too. Not usually. Make sure your surgeon looks at that. Make sure that none of the sutures that are absorbable sutures have come loose. So a lot depends on how far out you are from your surgery, but certainly I'm a big fan of red light. Red light, you're probably using a combination of red light and infrared light, a near infrared. And sometimes near infrared penetrates a little deeper, so it could be heating it up a little bit. But, it shouldn't bleed, though. Make sure they check that out. I'm just afraid to tell you this and ignore it. But check, go get that checked for sure. Make sure that thing heals up correctly.
Jerry, thank you for asking that, and keep us posted. Keep us posted with what you find out. Thank you for being here as always. Nicole is asking, is there any test that can detect what vitamins or supplements your body may be deficient in?
Yeah. We do a lot of micronutrient tests, which test a ton of your nutrients, vitamin C, zinc, copper, selenium. I mean, you can get a specialized test. Insurance doesn't like to pay for it, but we can ask for the Quest micronutrient test, and that's a good one. With our Cleveland Heart Panel, we look at several vitamin levels, like B12, folate, which are very important. We look at your CoQ10 levels. We analyze your fatty acid levels to see whether you need more omegas and that type of thing. So the Cleveland's the best thing we do. It's a great baseline test for most important things. But then if you're really interested and you can't find out anything you think you may be deficient, you can certainly get a Quest micronutrient panel.
Nicole, thank you for that. I'm going to get to Stephen here. Thank you, Stephen, for being here. Hi, back to you. I've been seeing a lot of info lately on Rosabella moringa. What are your thoughts on this supplement?
A lot of people take moringa. I personally don't take it because I'm not that studied on it. A lot of people take it as an antioxidant. Some people take it for insulin resistance. But I can't tell you from personal experience how well it works. But it's certainly a pretty popular supplement. It's just kind of getting it out there, and certainly there's nothing bad about it that I know.
Thank you, Stephen, for that. I love hearing. We haven't heard Rosabella moringa often, so thank you for putting that in there. I'm going to put this up from Evangeline, longtime listener, multi-first caller. We love you, Evangeline. Thank you so much. And I'm seeing a few questions here around berberine for weight loss, so I'm going to try to knock all of them out with this question from Evangeline. Would 800 milligrams of berberine twice per day be detrimental to health or beneficial for aiding in weight loss?
That's a pretty high dose. But you're probably talking about the berberine hydrochloride. We prefer the dihydroberberine. It's just more potent, and find that you don't have to take but 200 milligrams twice a day of that because it's about 4 times more potent. So it'd probably be equal. We'll certainly use it for insulin resistance, but we use it for weight loss as well. So get the dihydroberberine, which is the only type I recommend. It's just better, and also more tolerable because you can use a lower doses of it. Sometimes you use too high a dose, it can give you GI problems. So I recommend the 200 twice a day of the dihydroberberine. And Evangelon he was one of our first guys that got on our show.
Yeah, Evangelon,
We
thank you
need to
so
give him
much.
some kind of award or something, don't we?
We got to. Evangelon, we're going to figure this out real quick, because I know that we're getting questions around berberine for weight loss. So 200 milligrams of the dihydroberberine twice per day. Can you give us, a comparison to the GLP-1s? Because obviously we've talked a lot about it being, a natural Ozempic.
They call it nature's GLP-1. It's certainly not going to be as potent, or you're not going to get the results as you are on something like Ozempic or Mounjaro. But for people that don't want to do that because it's expensive for one thing, and some people it makes it nauseous. I usually don't get too much, pushback on dihydroberberine for causing GI problems. But it's certainly, you're not going to lose weight as quick or as much as you are on the shots. There's no doubt in my mind, but we do. I think I was asking Katie today about, our berberine. Do we have enough of it? And we have to constantly reorder it. I think it's the biggest vitamin that we actually send out. That, Digest Shield, and the Super Multi, by far.
All right, Evangelon, I hope that helps a little bit. I'm gonna see where I'm at here. I want to make sure we get a couple more questions. I know I'm missing a ton here. Let's get to Lisa real quick. Lisa, thank you for being here as always. Since my major colon surgery at the end of January, unfortunately, I still suffer from diarrhea. Do you think this will improve? Also, I now have malabsorption issues, especially including vitamins, calcium, magnesium, B12, and K. Will one multivitamin help me, or do I have to take each one individually? So it seems like these vitamins individually, or just one multi to help with the malabsorption.
If you get a good multi, our Super Multi is packed, but you're going to probably need to take the magnesium separately at night. And if you have diarrhea, certainly don't take magnesium citrate. Take magnesium glycinate, or our combo where you have glycinate, threonate, and malate, which is my favorite, because that won't upset your stomach. If it has citrate in there, it'll give you worse diarrhea. So you can either take something like ours, or plain glycinate, or perhaps even, doing it through a foot rub, or magnesium lotion.
Yep.
But certainly you'd be one that would be a good person to get the micronutrient test, and see where you are after proper supplementation. Yeah, I think it'll get better. I really do. It's one of those things that short gut syndrome because of your surgery, but it'll get better over time. You have to find out what you can eat. The main thing is, what kind of diet you're eating.
Yeah.
You got to be really kind to your gut with that. Something like maybe an autoimmune type diet. No glutens, no dairy, no nightshades, no soy, no corn, no sugar, that type of thing. I wonder if you could try a carnivore diet. And certainly you should be one that's maybe supplementing with Digest Shield for sure, which is our favorite all-around gut product, or possibly even colostrum, that type of thing. But good luck. You're going to get better. It's going to take time, though.
Lisa, we love you. We're here with you. Keep us posted with how you're doing there. Thank you for being with us tonight. I want to get this from Jenny. Thank you so much, Jenny, for this question. Supplement recommendations to raise white blood cell count in cancer patient receiving chemo. What's your thoughts on this?
With chemotherapy, it's going to be hard to raise your white count through supplements. The oncologists use some potent medications to raise your white cell. If it gets low, one or so, you're gonna have to take one of those. It's on the tip of my tongue what they use, but um, it's not ringing a bell right now because I never use them.
Mm.
But listen to your oncologist on that.
Mm.
Certainly, a lot of it depends on what type of cancer and what type of chemo. So you're really going to have to get an oncologist that hopefully understands supplements as well. Some of them do, some of them don't. My conversations with Dr. Matuk around here, she's very keen on supplementation. Her theory is use low dose chemo along with some of the other adjunctive treatments that we use. So I'm not sure if IV vitamin C may help a little bit.
Yeah,
that would come to mind. I don't know why I can't think of the name of the medicine they use for that.
I'm gonna make a quick note of that, Pomp, just so we it'll probably ring a bell later on. Jenny, I'm gonna make a note of this.
But it's not a supplement; it's actually a prescription medicine that the oncologist use. So it's not a supplement.
Okay, and we're running out of time, guys, and I know I'm missing a ton of questions, so we might have to write a few of these down and take them next week. Real quick, I saw one around a visit here. I want to put this up from Chrissy just to make sure we can clear up anything. Okay, forgot to ask any of this in my appointment. Is creatine safe to take when autoimmune panel and dsDNA antibodies are positive? Been positive since taking omeprazole last summer, off the med since September, so it's possible it's lupus and not a drug-induced lupus flare. I am very active and lift weights and have been planning to add for a while, but hesitate after the autoimmune flare. I know it's very safe supplement, but just second guess myself. By the way, LDN is...
Oh, good. Yeah, I hope the other patient can get on LDN that has 7 autoimmune conditions. But certainly, creatine, it's safe. Yeah. Not anything wrong with it.
Thank you, Christy, for putting that in. I hope that helps. Let's see. I'll take if I could find one. I know I saw. Let's see this from Whitney. On a previous Q&A, you mentioned a COVID detox protocol you've been recommending. Can you give the name of it again? Is it recommended for everyone or only in certain situations? Trying to get my parents to detox.
Good question. Yeah, it's called Dr. McCullough's Spike Detox Protocol. And if you call the office, we'll just, fax it or email you a copy of it.
All right, Whitney, I hope that helps a little bit. Real quick.
Or you can Google it, Dr. Peter McCullough's Spike Protein Detox. Come right up.
See if I'm reading this right for Diva here. How to decrease cortisol and histamine. I'm high in both, no tumors on adrenals and pituitary, but I have partial empty sella. Any thoughts on this, Doc, for Diva here?
So look at all your hormone levels if you have partial. But we like to use adrenal adaptogens to decrease cortisol levels, like ashwagandha, rhodiola, ginseng, L-theanine. Rarely have to use anything heavier, as you probably don't have Cushing's. That's a different matter there. Histamine, when I think histamine, I think gut a lot of times. Certainly, I don't know what kind of symptoms you have from high histamine. Is it rashes, urticaria, hives, or is it runny nose, or is it eczema, that type of thing? Certainly, I love Zyrtec. I think that's a pretty potent antihistamine. There's something called DOA that you can get from one of the supplement companies. It's more of a natural supplement. It works pretty well, but think gut when you think histamine. And also, you might want to block down the H1 and H2, so you can use something like Pepcid and Zyrtec at the same time. We use that a ton with COVID. So I hope that helps you.
Thank you, Diva, for that. And real quick, I'm going to take this last one. I'm just going to put this up from Max. I saw it cross my eye, and I just want to put this up for Doc. My CRP on February 3rd lab work was 44. March 3rd, 3 feet of small test was taken out yesterday. Another lab work at CRP is 129.
Wow.
And let's see. I think there's doctor said I'm getting the highest dose FDA approved of Simponi. Okay. Goodness. Thank you for that comment, Max. Am I reading that right, Doc?
Yeah, I'm not sure if that would do it or not. That's a potent medication. That's a high CRP. Something inflammatory is going on with you. It's probably from your guts that you've had just see what happens to it. Certainly, look at what you're eating. You need you need an autoimmune diet. You really have to stay away from anything that's inflammatory to your bowels. And certainly, you may be one that should add turmeric. I don't think of anything else. It'd be nice to look at your adrenals, and really you need something like a Cleveland panel. Look at your other inflammatory markers. Is it just and hopefully that's an HS-CRP, which is highly sensitive CRP. A plain CRP doesn't mean much to me. You got to get the HS-CRP and look at your other inflammatory markers like we always get on the Cleveland, like a myeloperoxidase, an LP plaque test, SED rate, because there could be some other factors. The fact that you had recent colon surgery really screws everything up a little bit, so it may take a little time to kind of settle down. So make sure you're getting an HS-CRP, look at your diet, take some turmeric, and see if you got any other autoimmune type phenomenon going on. Certainly something like LDN might help you a lot too.
Max, thank you for putting that in there, and keep us posted on that. I hope that helps just a tad. Real quick, this is going to be the last question we take, guys, and I'm going to write down. I know I'm missing a lot, so I'm gonna make sure we get all the ones I'm missing first up next week on the show. This one I like just because I'm interested in your thoughts, Doc. How long after vitamins expire should they be tossed? Vitamin D in particular. Do you ever become toxic after the expiration date?
Old vitamins are kind of like old guitars. They get better with age. I'm kidding, Dave. I know Dave plays guitar. No, old vitamins don't get better with age, but they don't get toxic, really. I mean, if you left, I guess certainly the worst one would be omega-3s. Fish oil could get rancid, but like vitamin D, it'd take a long time. Most of them have at least a 2-year shelf life. Our vitamins we have made have no fillers in them or preservatives, and they last 2 years, not without refrigeration. But yeah, I mean, it'd take a long time, and most of them, the normal vitamins don't get toxic. They just may lose a little bit of potency. Personally, if I had a vitamin that expired 5 years ago, like a vitamin D or I'd still take it personally. Yeah. We have to toss them. We've got several now, a whole bag full of them, occasionally in a toss. I'm gonna see if any I want or anybody on our staff wants them. But no, they're not going to usually hurt you. They have to put that. They like to sell vitamins, of course, but fish oil would be one you wouldn't really want to hang around a long time. I guess if you could look at them, if they change color or smell bad, you shouldn't take them. But for most, I would personally take them after. I'd probably take them a couple of years after. But that's me. Officially, I should just say, if they're expired, don't take them. But it's not that big a worry, to be honest with you, unless it's fish oil. Unless you see something weird.
No to fish oil after expiration date, of course, if it smells weird.
Yeah. And a lot of times, if you cut into a fish oil tab and it smells rancid, it's not a good quality fish oil anyway.
Yeah. Dave, thank you for that. I'm going to put this up from Robin. DAO enzymes, DAO enzymes for high histamine is great too. Thank you for
Yeah.
this, Robin.
I think that's what I meant to say. D8. Yeah, I didn't say it right. But yeah, that's a great one. I forget who makes that one. It's because I've got some of them. It may be Quicksilver. I think that's who makes the one that I've had. But yeah, they're good.
Guys, how did we do? I know what we're going to do as a team. We're going to take down the questions that we missed. I know I was having trouble finding my spot, so I apologize for that. We will get them first up next week on the show. Tuesday, we're going to be back 7 p.m. I hope all the Linda Carter fans come back next week and check out the show. Let us know how we did. Doc, how do you think we did?
I think you did great. I don't know if I was off my game tonight or not, but
I'm going to put this up from Tom. Thank you, Tom, for this. I want to put this up for Katie and Carter. They're doing the coolest thing on Instagram called Organic Working Twins. They're documenting, organic living. And again, I brought this up last week around the butter, and it was so fascinating. I think I watched that reel. Like,
they turn their own butter, don't they?
Yeah, they turn their own butter, and of course, we were talking about Brookhaven Farms earlier. Carter was grilling a steak. I hope she's eating it right now and enjoying a great dinner. But
they've got a great site. It's cool.
They Organic Working Twins. That is on Instagram. Tom, thank you so much for that. Check them out, guys. Follow the journey. I dig it. Okay, and Kristen, I see your question. We're going to get that first thing next week. Thank you, Steve. Thank you, Dave. Thank you, Wilma. Wilma, I missed your question. I'm going to get to that one as well. We will be back Tuesday, 7 p.m. Doc, are we good to go?
We're good to go.
Call it a pod.
See you later.
Jennifer, thank you. Jennifer gave us a 10. Thank you. Frida gave us a 10 plus. I love it. I'm going to put this up from Evangelon because it caught my eye. Use expired fish oil in your vegetable garden. There we go.
Great. I love it.
I love that. I love that. All right. We are out of here. I'm looking for my outro. Let's see where we at, Brad. Love you, Pop. I'll see you soon.
Love you. Good night.
Don't go away.